Hi, everyone. If you're a loyal vlog watcher of mine, you'd be happy to know that today is the second time I'm vlogging in one day. See, I have the same dress on that I had before. I took my bra off, so I'm showing a little bit of cleavage. But I wanted to come on and do a brief vlog. I'm trying to do ones now that are more targeted and not just be rambling for like a half an hour, because I want to do some Duolingo, and then I'm going to be getting to the gym to exercise. And guess what I'm doing tomorrow? Wait for it. I am going to go on a speed dating thing tomorrow. Which, like, I haven't dated since this whole shabam. I haven't dated since before the pandemic. Right before the pandemic was my last date. But I am relatively comfortable with my wardrobe and my body to wear like a black top to cover up my belly. And I don't know, see where it goes. Yeah, I got my tattoo. See, well, now I can show it better because I'm not in the car. Sorry if I have deodorant marks in my armpit, but isn't it? I can't go upside down. Isn't it pretty? It's so pretty. I'm so happy with how it came out. It's still peeling in case like you see skin hang off or whatever. It peels for a bit. It takes 2 to 4 weeks for it to heal, but I love it. And it was on my right side. Again, I'm not a medical doctor, all that disclaimer stuff. But I was just very happy that I had all my drama on my right side and my biggest tumors on my right side and my lymph nodes. What was it, 6 or 7 they took out on my right side. But my breast surgeon said I can get a tattoo, so I got a tattoo, and it's much bigger than I was expecting to. I mean, it's fine. It's like, I mean, he asked my approval beforehand, and I think it's really pretty. And when I get older and my skin starts to wrinkle, look at that fun little thumbnail right there. So when my skin starts to wrinkle, it won't wrinkle in the flowers. See that? Well, a little bit there, but that's okay. Anyhow, that has nothing at all why I'm vlogging. So the reason why I'm vlogging is because a friend of mine reached out to me and said that one of her friends or sisters or siblings or whatever has breast cancer, had a mastectomy, and wants to know my 2 cents on Tamoxifen and Lupron. Such a hot topic. Such a hot topic. And what I'm going to say today is my opinion completely. None of this is, I mean, it's such a personal decision about what you want to do. You have the information and you make the best decision you can with the information you have at the time. I've heard that phrase numerous times from the oncology psychologist. So I'll reiterate what I said in my last vlog. Anyone who's been recently diagnosed with, I guess, any kind of cancer, I highly recommend that you see an oncology psychologist. If you need meds, that would be a psychiatrist to help you like navigate this world. So the 2 cents of, they hear horror stories about tamoxifen. Like, who goes on tamoxifen and is like, woohoo, I'm on tamoxifen. No one likes going on meds. No one likes going on meds, and it's a very personal decision as to what you want to do. My guess is that their cancer is hormone positive, which is why they're going the tamoxifen route. So, and again, I know nothing about chemo and radiation because I didn't have either. I had my double mastectomy. I went on tamoxifen a couple months later, and then started the Lupron injections every month for 26 months. And then I started the Zometa infusions. It was like October was tamoxifen. I think December was Lupron, or maybe November. And then Zometa started like in December or January, like the kind of back to back. So it was hard at that time to know like what side effects were from what. But start with the tamoxifen. Again, you can go into details about what I'm actually, like look at prior vlogs for me to like go into detail about each drug. That's not what I'm going to do. But again, my 2 cents, everyone's different, whatever. But the tamoxifen, like, it's like when you go and look at an Amazon review, most of the people that leave those reviews are not the people that are like, I love this item. Does it happen? Sure. But the people that like to write like paragraphs of negativity, it's because there tend to be negative people. And granted, sometimes I am like that too. You've seen my vlogs. I cry, I'm mad, like whatever. But I also am not like that sometimes, and which is why I try to get on there too to counteract the like woe is me. Which you should have some woe is you after a breast cancer diagnosis. But the tamoxifen for me, I had heard stuff too. But I'd also heard some people that said, like, they don't have side effects at all. So how do you know? So I tried it, you know? At the time, like, I was, less so now, like a very, you know, by the book rule follower. Like, the doctor says this, so I must do this exactly to a T and, like, not, you know, veer from that road whatsoever. So that's what I did with all this stuff. Like, what do I know about cancer? Like, they're the experts, you know, let them tell me what to do. And I did that for like 2 years. And then the discussion was, oh, maybe we should keep you on the Lupron. And I'm like, no, the Lupron's making me batshit crazy. And that's when I started advocating for myself, that I learned more about me and these meds and stuff. And my plan was always to be on Lupron for 2 years and see what happens. And knock on wood, I have not gotten a period since I stopped the Lupron. So I had to go through menopause again. But the tamoxifen, I've had such a variety of side effects from. You could rewind and see where all those are within my journey. You know, I think about last summer because I get these flashbacks on my memories on Facebook that when I went to Germany, and I remember that I had ice packs on my ankles, and my Achilles were so bad. I used kinesiology tape because my Achilles, like, they just hurt so bad. I got Brooks sneakers. I tried using inserts. I tried only using shoes that had like an arch support, and started wearing heels a lot because being on a heel would help with my Achilles. It was awful. But like, has anything changed? I'm still on the tamoxifen. That hasn't changed. The dosage hasn't changed. There was a time where I take 20 milligrams. I think that's standard. There was a time where I wanted to be off of it. Sorry, I should put do not disturb on when I blog. It's distracting when the texts come in. It's so distracting when the texts come in. And the absent-mindedness, like, granted, like, I could say that's because of meds, but going through menopause and getting older as a woman, like, that shit just happens anyway. I don't think that's related to cancer whatsoever. I think it's just related to aging and stuff. Anyway, so yeah, I look at these flashbacks and I see where I was with stuff. But like this summer, again, nothing's changed with the tamoxifen, same dosage. What I'm saying is there was a small period of time where I didn't know, I was feeling awful. And I'm like, what do I have control over? Can I like stop taking the tamoxifen for a period of time? One of the nurses brought up to me, like, you know, do you want to take a break from it? And I didn't even know that was a thing. So just know that, like, that's on the table too. Just because you start something doesn't mean like that's what you're glued to forever, you know? Again, I'm not a doctor. I'm just telling you my experience with what happened with me. So I went off of it, I feel like for 2 weeks or something. And then there's almost like a psychosomatic thing where like, oh, I feel better. Really, if you do or not, it's hard to tell. You'd have to be on for a longer period of time. But then the more time I was off of it, I'm like, but what if my cancer comes back because I just chose to be off of it? Like, you know, how much do I want to suck up side effects and still be here to like see my kids grow up and lead my like happy, you know, life? So I went back on it and I weaned up to it because my body's very sensitive to meds, and being hammered with tamoxifen, Lupron, Zometa, like kind of back to back was a lot on my system. Again, I was just following orders and didn't get into it then like, oh, my body's sensitive to meds. It was like, no, get the cancer out. Whatever I need to do, I will do. But that's me. I don't know. And then I've been on the 20 milligrams since. But like this summer, I didn't do anything different to my Achilles. Sometimes I wear flip-flops. No way could I wear flip-flops last year. Did I do anything different? No. Is my body getting used to it? Maybe. I don't know. I did switch oncologists at one point relatively recently. I feel like within the past like 6 months or so, when the discussion was to continue the Lupron. And I'm like, no. And then with the Tamoxifen too, where I'm like, I want to take that out of the equation for a minute to figure out if the side effects I'm having are from the Tamoxifen or from the Lupron. I don't know. But I get when things first happen, like they want to pound stuff out to like make sure that you're good to go. And I respect that it's a personal decision, but I have friends of mine who are like, I heard, bad things about the Tamoxifen, so I'm choosing not to do it. I'm all into holistic stuff and like, Eastern medicine, whatever. But for me, you get to a point where there's been so much research on things that this targets this, and it's very specific, that like, I don't know if I want to put my life into the hands of things that may or may not work. Chemo is awful. Radiation's awful. Surgery is awful. And, they've done research on these things. They wouldn't just give it to you if it didn't work. So, and one thing too, after I switched oncologists, she had told me that like the rule of thumb with the tamoxifen was that you're on it for 10 years you're on for 10 years. She said now, again, I'm not a doctor, that they're saying that being on for 7 years has the same efficacy as being on for 10 years. How proven that is, I don't know. Don't quote me on that. I'm just telling you what I heard. So if that's the case, then I'm 3 years out of 3 years into taking tamoxifen, which means I have 4 years left, which is like almost halfway. So if I had to do this for, another 4 years, would I do it? Probably. Well, not probably, I would. The next conversation for me is now that in October, right now it's August, if I still don't have my period, knock on wood, that it's not going to come back. The question or the discussion is, should I switch to an aromatase inhibitor? Which I have, again, heard people say they have horrible joint pain. Their hair starts to fall out. I mean, obviously, you can see my hair is thick. Weirdly, these are penciled in. My eyebrow hair is thinned out and stuff. And other, like, my armpits and my legs don't really grow much hair at all. Whether that's because of meds or getting older, again, don't know. Too many moving factors. So I get it's a very personal decision. I don't know if I want to go on the aromatase inhibitor. And again, same thing for that. What could happen? I could switch, see how I do, because now I'm not on the Lupron or the Zometa, so those aren't factors of anything yet. Switch on to the aromatase inhibitor and see how I do. Again, it's the devil you know versus the devil that you don't. I don't know what side effects I'd have from the AIs. I might not have any at all. It's just something I have to think about and read more about. I feel like I didn't do as much research individually as I could have. Because again, doctors don't want you to go on Dr. Google. They want you to go by what they say. The Lupron, there was really no question about the Lupron, man. Because I had an IUD before all this stuff happened. And I had one for not the same one. I had one for 10 plus years or whatever, changed out routinely like you're supposed to. But when my IUD was taken out, because, as soon as they found out my breast cancer, the IUD, it emits hormones, so that sucker needs to come out. So they took it out, and then it was boom, blood everywhere. And I couldn't even get off the couch. It wasn't even a way to live, to be that way. So the Lupron, was there a question for me? Absolutely not. I can't go through life bleeding profusely, sitting on a couch, not feeling well because you have all this blood coming out of you. It was awful. The Lupron stopped my periods almost immediately, throws you into a chemical menopause. So then you have the side effects of going through menopause, and when your body isn't ready to go through menopause. So fast forward, I did that. The plan was to do it for 2 years. And at that point I would have been 51. And let's see where my body is at that point naturally. So that was the plan. And again, when I started getting close to that 2-year mark, my oncologist at the time was well, there's no reason that we have to stop. We can keep going. But I had and again, you can rewind and see the previous vlogs. I had, concerning side effects from the Lupron, not even so much at the beginning. I feel like it was later on, and why the change, I have no idea. But like I hit a head. It's funny because I'm so behind on my vlogs, posting them on YouTube because of my side effects for the Lupron. But that happened in like shortly after I stopped the Lupron. But I just would notice this pattern of a week and a half-ish before I was due for my next Lupron. Like I would get very like aggressive and testy and just difficult to be around, and like very testosterone. Like I punched a wall in my bathroom early on in taking the Lupron, and like that's not me. I joke, like, but it really wasn't funny. And then I started getting kind of concerned, but I'm like, I'm almost done with it, so I'm just going to suck it up. And just that week and a half, I'm just going to like stay away from people and just, do me, and that's it. You find ways around things. I bought a lot of like, not fidget things, but like things that I could squash versus like punching a wall. That would help. So with the side effects. So I definitely had more side effects from the Lupron than I did from the Tamoxifen. I did the Lupron for 26 months, or 26 months instead of 24, only because the Runway for Recovery show was coming up, and I didn't want my period for the Runway show, so I stayed on for an extra 2 months. I actually will be in the Runway show again this year. Typically, you walk 2 years and that's it, so they can allow other women to walk, but they want to have a bunch of, or more, alumni models, so I'm going to be outfitted again and dolled up and stuff for Runway this year, which is in October. Yeah, so I'm excited for that because like the store that I actually picked the store that I wanted this time, and I'm like, I don't want to be classy. I want to look sexy. So I had to see what clothes they have where I could look sexy, because I'm not as like hating my body these days as I have been. So that was the Lupron, and I'm off, and there's no reason to go back on because, like I said, knock on wood, I haven't gotten my period, so that shouldn't even be an issue. The Zometa, again, personal choice as to what to do. I didn't know anything about the Zometa whatsoever. I just listened to my doctor. My first oncologist, I mean, she's a very, very, very bright person, and not all oncologists do Zometa infusions for their patients. If you are in Europe, my understanding is that it's pretty much protocol that if you have cancer, they will have you do Zometa infusions. I find it interesting that here in the States, it's not part and parcel with like you do one, you get the other. But there was an Austrian study, I believe, of where the study was that if you were on Zometa infusions, it lowers the risk of your cancer coming back. It keeps your bones strong. It basically keeps the cancer out of your bones. Keeps you from getting osteoarthritis or osteoporosis or whatever. Basically, just keeps your bones strong and keeps the cancer out of the bones. Oh crap! Alexa, shut off. I gotta get changed and head to the gym. Yeah, and when you do the Zometa infusions, for me it was every 6 months, which I think is like this for everyone. It's every 6 months for 3 years, and I just had my last one in July. When you have this, and I've done series on this, so you can again look back at like day 1, day 2, like what happens during the Zometa infusions. And if you are getting one coming up, make sure that you watch the vlog before the day 1, because I've learned tips and tricks, especially the Claritin thing, that I didn't know about early on, which was a very big game changer and side effects for me. But the doctors no doctor told me in the beginning to take Claritin beforehand. They're just like, go. I didn't know to hydrate ridiculously. Lots of things I didn't know because no one told me. Anyway, foot cramps, oddly, that was another weird side effect that I feel like was from the Tamoxifen too. They started coming back recently. I don't know why. But I just, waited out, I don't know, 30 seconds or something, which seemed like the longest 30 seconds ever, and then it just goes away. Again, I don't know if that's from the Tamoxifen, but I never had them until I started the meds. So the Zometa, you basically feel like you had the flu for like a week, or for me, for like a week after you have your infusion. So you're kind of out of commission. But for me, it's like you feel like shit for a week, but you're doing that 6 times in your life. So going through, feeling like shit for a week every 6 months for 3 years, like, okay, I'd rather feel like shit for a week 6 times than have my cancer come back in my bones, because then, like, you're fucked. Like, that's not what I want to have happen. I shouldn't say you're fucked. That's not what I just mean, like, it's not a good thing if it goes back, and it's not a good thing for it to come back. It's definitely not a good thing for it to come back into your bones. Not a good thing to have your bones weak and have you, like, break bones and stuff easily as you get older. Women, have to keep on top of that anyway, just because as they get older, many women have issues with keeping their bones strong. And, being arthritic and osteoporosis and all that kind of stuff. So would I change anything? Absolutely not. I mean, yeah, it was a lot on my system in the beginning, but, like, I didn't know any better. And I love that phrase that you make the best decision for you with the information that you have at that time. Because, yes, now I know different things, but at the time I didn't know those things. So if my previous vlogs can help you make your decision, then that's great. Don't blame me for anything, because, like I said, not a doctor. I'm just sharing what I've been through, and, like, what I've learned. And I would strongly suggest that you stay away from support groups on social media, because often it's just a matter of people bitching and moaning about stuff, and it's rarely positive and it's rarely supportive. It's more like, here's some horribleness and let me share my horribleness to add to the whole conversation of horribleness. That's not what you want or what you need. The biggest supports for me, I did, at least locally, if you're in Massachusetts, and I'm sure they have stuff like this, like, around by everyone. MGH, Mass General, has a program called Paving the Path to Wellness, which actually was, my oncologist was like the founding person for that. I found a very nice support group in the paving program. There was the SMART program, it's an acronym, Strength Management and Resilience Training. I was resilient before. Now I'm like redonk, resilient. That was a fantastic course, but I didn't connect, like, we didn't keep in touch after the course was over with the people. Paving, there's like a group, so, like, they do stuff outside. I found out about the Runway for Recovery, company. They're, like, it started here in Massachusetts. They started a show in California, and they are starting a show for the first time this year in New York, like New York City. So, I don't expect them to stop growing. And it's a fantastic organization, particularly for people who have stage 4 metastatic breast cancer. So there are things that you can do. There's the Healing Garden in Boston. There's the American Cancer Society. There's a Livestrong group at the Y. There's a lot of things that you can join that are positive, like when you're ready to get to that point. There's a group that I never joined that I wanted to, where, like, there's no discussion of anything. It's purely an art thing. Every week you have a different prompt, and, like, it was through Zoom, because it was I was diagnosed during the pandemic. It was 2021, and you paint. You just paint. That's it. And it's like a bunch of cancer patients painting over Zoom. And sometimes you just need some freaking peace and quiet and just to paint. It all depends on where you are. So I need to get going, because I gotta get changed and get my butt to the gym, so I can look, all hot and muscular, like, doesn't that look so muscular? Anyhow, but my best advice, make the best decision that you can for you with the information that you have right now. It is your decision. It is your life about what to do. But if it were me, I'd listen to the doctors in the beginning and then, try it out. The worst thing that could happen, I would think, is that you just, like, stop taking it. I've never heard of anything irreversible happen if someone started one of these meds and then, like, had side effects that, like, something didn't go away. Could that have happened? Absolutely. I just have not come across that in my, in my world of breast cancer survivors. But it's your body. It's your choice of what to do, obviously. I'm just giving my 2 cents. Like, does it suck? It does suck. It does suck, and I'm 3 years out right now, and does it suck right now? No. I wore a push-up bra for the first time. That sucked a little bit. Not at the time, because I'm like, look at my boobs. I look fucking awesome. But then they really hurt towards the end of the day. But I'm like, it was good while it lasted. I had cleavage. I looked like a normal freaking human being. Except that like my belly was kind of big, which is why I need to get my ass to the gym. All right, so I'm hanging up now. Again, make the best decision you can for you with the information that you have at the time. If my vlogs can be of any information for you, then that's great. That's my experience. Like I said, I'm not a doctor. I'm just like a chick who got diagnosed with breast cancer, had a total mastectomy, got on these drugs, and this is what my life has been. So, feel free to read my stuff. Feel free to not listen to me. Like, I don't care, but you need to do what's right for you. And it's not like either all or nothing either. Or it's not all or nothing either. You can try something. If it doesn't work, then you don't, but keep an open line of communication between you and your medical team and advocate. You don't feel good, say something. You have to advocate. It's exhausting. I totally get it. I still have that lump here going on. I know that it's not cancer, but like, what is it? No one knows. I went through 3 opinions and I'm still not done. But you have to keep advocating for yourself. And even if you're going with this whole thing solo, hello, so did I. I had friends that stepped up, but my go-to people, most of them went away. A lot of them went away. So you can do this on your own. If you are doing this on your own, you can. You just have to love yourself and advocate for yourself. All right, that's what I got for you. Till next time. Bye.